بسم الله الرحمن الرحيم. السلام عليكم أعزائي الطلبة. Our subject is epistaxis. Epistaxis, derived from the Greek term epistasian, is defined as a bleeding from the nose. It is one of the most common ENT emergencies. Epistaxis has been reported to occur in up to 60% of the general population. It has a bimodal age distribution, with peaks at age younger than 10 years and older than 50 years. Reasons for excessive bleeding: due to vascularity of the nose. Both external and internal carotid arteries. The blood supply of the nose comes from both the external and internal carotid arteries. There is an arteriovenous and arterial anastomosis within the nasal cavity. The blood vessels run just under the mucosa and protected. Larger vessels on the turbinate run in a bony canals, cannot contract. The blood supply of the nose comes from the branch of the external and internal carotid arteries. The main artery of the nose is the sphenopalatine artery, and the most common site of the epistaxis is the Little's area, which contains the Kieselbach's plexus. The Kieselbach's plexus consists from the greater palatine artery, sphenopalatine artery, and the superior labial branch of the facial artery, plus the branch of the internal carotid artery, which are the anterior and the posterior ethmoidal arteries. The common bleeding sites are Kieselbach's plexus at Little's area, Woodruff's area in the posterior part of the nasal cavity, retrocolumbal vein in children, and middle turbinate. And even epistaxis can occur from the sinuses and from the postnasal space. This is the retrocolumbal vein, which is the most common site of epistaxis in children. And this is the Little's area with the confluence of the arteries, the anterior ethmoidal, greater palatine, sphenopalatine, and superior labial artery. Sphenopalatine artery is called the artery of epistaxis. It is the main blood supply to the nose. Classification of the epistaxis: we have different types of the classifications. One of the classifications is according to the cause, either primary or secondary. The primary or idiopathic, there is no proven causal factor in 70 to 80% of the cases. While the secondary epistaxis, there is a proven causal factor, like trauma, whether surgical or non-surgical trauma, or anticoagulant overdose. Another type of the classification, according to the age of the patient, we have the childhood epistaxis when the age of the patient less than 16 years, and the adult epistaxis when the age of the patient more than 16 years. Also, we have anterior epistaxis and posterior epistaxis. Anterior epistaxis, when the site of the bleeding comes from area anterior to the piriform aperture of the nose, like from the anterior septum, vestibular skin, and membranous septum, and this is the most common type of epistaxis, the anterior epistaxis. And the second one is the posterior epistaxis, posterior to the piriform aperture. This is the piriform aperture of the nose. When the bleeding coming anterior, from area anterior to this aperture, it's called anterior epistaxis. When the epistaxis comes from area posterior to this aperture, it is a posterior epistaxis. The comparison between the anterior and posterior epistaxis, the anterior one is more common. It occurs in children and young adults, usually due to mucosal dryness, and it is less severe. While the posterior epistaxis, it is less common. It occurs in older population, usually occurs in hypertensive and arteriosclerotic disease, and it is more severe epistaxis. Causes of epistaxis, we have the idiopathic epistaxis. The vast majority of cases come under this category in 70 to 80% of the cases. While the local causes of epistaxis, we have the trauma, epistaxis digitorum, nose picking, and it is the most common cause of epistaxis in children, and foreign bodies, and surgery for the nose, paranasal sinuses, and postnasal space, irritant like cigarette smoking, medications like topical corticosteroids, acute and chronic rhinosinusitis, septal deviation and septal perforation, tumors and vascular malformations like angiofibroma, aneurysms, nasal papilloma, hemangioma, and squamous cell carcinoma. While the systemic causes of epistaxis, we have the hemophilia and other types of blood dyscrasia, hypertension, no proven association between hypertension and the epistaxis, but usually hypertensive patient presented with severe epistaxis, and it is posterior type of the epistaxis. Another systemic causes of epistaxis are leukemia, liver cirrhosis, and factor deficiency, medications like the aspirin, anticoagulant, and non-steroidal anti-inflammatory drugs. So it is important in management of patients with epistaxis. We should ask about the drug history. The platelet dysfunction, thromboasthenia, and thrombocytopenia, diffuse oozing, multiple bleeding sites, or recurrent bleeding may indicate a systemic process. Epistaxis according to the age. In children, the most common cause are nose picking and foreign body. In adult, idiopathic and trauma. In middle age, tumors, and in old age, hypertension. The management of epistaxis is well summarized in an age-old dictum. We put the term rest as an abbreviation for this management, R for resuscitate the patient, E for establish the bleeding site, S for stop the bleeding, T for treatment of underlying cause. The treatment of epistaxis includes first aid and resuscitation, definitive treatment, and prevention of recurrence. The first aid measures are leaning forward, pinch the fleshy part of the nose, not the bridge, for 10 to 20 minutes to put a pressure on the littles area, which is the most common site of the epistaxis. Avoid swallowing the blood and apply an ice pack on the nasal bridge for reflex vasoconstriction. And this is the position of the patient with epistaxis. The resuscitation, resuscitate as follows in cases of severe epistaxis. Assess the blood loss, assess the pulse and blood pressure, gain intravenous access, set up an intravenous infusion if the blood loss is great or if there is a cardiovascular compromise. Take a full blood count, assess the coagulation profile, group and save the blood. These are the instruments which are used in management of the epistaxis. This is the nasal speculum, Killian's nasal speculum, and this is the kidney dish for spitting of the blood, the Mirocele tampon, rapid rhino tampon, Foley's catheter for management of the posterior epistaxis with the use of the local vasoconstrictor and the local anesthetic. Another instruments like the teleforceps and the PIP for bismuth iodophone paraffin paste, which is an antiseptic substance. And these are the tampon and rabbit rhino and the Foley's balloon and catheter. This is the Foley's and the nasal balloon and catheter for the management of the posterior and anterior epistaxis. Thank you and good luck.